Let's have public comment. Are there speakers on this item?
Mr. Chair and members, or I guess it's just Mr. Chair right now, isn't it? Thanks for your patience and your persistence and hanging in here with us. I want to let you know I don't just come to complain and attack. I'm actually here, and your sergeant's handing out a letter from our organization expressing our strong support for the proposals of Assemblymember Brown, as well as from the C4A, the Association of Area Agencies on Aging. That's an important list of issues and funding, and I want to call out one of them, and that's the Long-Term Care Ombudsman Program. And all of the things that we'll be working on in this session, funding the $4.2 million request for the Long-Term Care Ombudsman Program is our first of many things that we would like to see done this year. It saves the state money by mobilizing volunteers. It avoids the need for lengthy and very expensive complaint processing and litigation, and it's a terrific program that needs adequate support. Thanks so much.
Thank you.
Good evening, Mr. Chair, committee staff. I'm Joe Rodriguez. I'm the California State Long-Term Care Ombudsman, and I oversee the operations of the Ombudsman program for the state. Back in 1995, the Institute of Medicine, the advisory group to the nation on health, conducted an evaluation of the Long-Term Care Ombudsman program and concluded that the Ombudsman program conducts a vital public purpose and that they can justly claim to have improved the long-term care system for residents. Last year alone, the Ombudsman program responded to and investigated more than 39,600 complaints made by or on behalf of residents of long-term care facilities. We know that we were able to resolve or partially resolve 73% of those complaints. Almost 3 out of every 4 complaints brought to us were resolved or partially resolved to the satisfaction of the resident. If it weren't for us, these are the kinds of complaints that probably would have gone to licensing, to the more costly regulatory system. I'd like to thank you for your consideration of the proposals that you've heard here today to restore funding to our program. We need this support. Thank you.
Thank you.
Good afternoon, Nancy Volpert from Jewish Family Service of Los Angeles again. First, I want to say thank you to you and your staff for giving these really important issues a substantive hearing and a time for us to raise as advocates our concerns for the clients and the frail elders that we serve, and to echo the support for not only the Older Californians Act and Older Americans Act program, but also in your budget discussion, there is a restoration of the multiple cuts, the MSSP program funding, and not surprisingly, we support that as well. So thank you very much for giving us so much time.
Thank you.
Thank you, Chairman and committee members. Brooke Hollister, Assistant Professor at the University of California, San Francisco. We heard a lot today about some of the problems with oversight of long-term care facilities and the challenges of protecting the residents residing in them. The Ombudsman program, the Long-Term Care Ombudsman program, as Ms. Jones was discussing, is an efficient part of the solution to that problem. They can often avoid or identify and resolve complaints before those complaints go to licensing and certification or CCL, and they do this by doing many things. And one of them is conducting unannounced monitoring visits where they can go into facilities, speak to residents, speak to family members, and identify those complaints before they get brought to more costly services. Unfortunately, since the budget cuts in 2007-2008, we've seen a great decrease in the number of facilities receiving those quarterly annual visits or those quarterly monitoring visits. In 2007-2008, it was 89% of facilities receiving them. In 2012-13, it was just 35%. So I encourage you to support the Ombudsman Association's ask for $4.2 million. Thanks.
Thank you.
Hi, Darren Dunaway with Human Services Association. I'm here just to support, and I'm excited that the Older Californians programs are being talked about and refunded and reestablished. It was a shame in the last 10 years to see those programs discontinued and the funding disappear. My organization had to cut 30,000 congregate meals from one year to the next because there wasn't enough funding. Home delivered meals has waiting lists across the state of thousands of people that are homebound. And Alzheimer's daycare resource centers, which were state of the art 25 years ago, are non-existent in California right now. So I'm here to support the proposal.
Thank you.
My name is Isaac Taggart, and I'm an ombudsman with the San Francisco Long-Term Care Ombudsman Program. This means that I investigate allegations of abuse and neglect in long-term care facilities. My role is not only as an investigator, but my role is also in prevention. Our program, we have to do quarterly visits to facilities, and this gives us an opportunity to identify issues that are minor and to stop them before they become more serious and more costly. In fact, that's fundamentally what makes our program different than the regulatory agencies, is that we are proactive. We are required to do visits to facilities on a quarterly basis, and we aren't necessarily only responding to complaints. We are out there and attempting to do those visits as best we can. The cuts in 2008 have drastically limited our ability to be able to do those, and we want to be able to recover our funding in order to be able to rebuild our program infrastructure to do those visits and better protect vulnerable, frail adults in San Francisco and across the state. I ask for your support in refunding our program. Thank you.
Thank you.
Hi, my name is Joe Coberty. I'm a AAA director serving the communities of Butte, Colusa, Glen, Plumas, and Tehama, and I have the honor this year to serve as the president of the California Association of Area Agencies on Aging. I want to reiterate Clay Kemp, my esteemed colleague's views on support for these programs. I want to drill down and talk a little bit about information and assistance and just point out that we receive about 450,000 calls a year for people looking for information, and each one of those calls generally results in 3 phone calls. It's not only the initial phone call, but there's the research, the follow-up, and then there is the addressing the issue with them. And then I want to support the caregiver's role, make sure we continue to support that. And then lastly, CCI has been talked about a lot today, and with CCI, these are the programs that really are going to make CCI successful. I appreciate that the administration is dedicated to seeing CCI through, and I'd like to also emphasize that it's important that we have a plan and an emphasis on dealing with the aging issues. Thank you.
Thank you.
Hi, I'm Nancy O'Keefe with Ombudsman Services in Contra Costa, and I just wanted to touch a bit on something that I see a lot in facilities, and it's the lack of dignity and respect. When residents when they're admitted to facilities, they suddenly become Ma, Pa, Gram, Gramps, honey, sweetie, darling, rather than being called by their names. They no longer have the privacies. I see so many times when curtains are not pulled, doors are not closed, when residents are being given care. And so I see all kinds of bare body parts that I don't need to see. And if I was that resident, I certainly wouldn't want anyone to see them. Thank you.
Thank you.
Thank you for your attention. I realize this has been a long day, and there's a lot of subjects here that are very near and dear to our hearts. I really echo what Assemblymember Brown said, and her thoughtfulness and looking forward to what is California going to do with our changing population. My name is Lisa Coleman. I'm the Executive Director for the California Long-Term Care Ombudsman Program, and I'm incredibly proud of the work that we do. And a 73% satisfaction rate, that says a lot. But we could do a lot more if we were better funded, and we really could save the state money. When you think about why we should be saving this money, it comes down to selfishness, really. Whether we like it or not, a third of us are going to spend time in a long-term care facility, whether it's for rehabbing or it's going to be the remainder of our lives. And when we're there, when we're at our most vulnerable, when our loved ones are needing help, we're going to want to know that there's an advocate there that knows the rules, they know the policies and the procedures, and they know best practices. Today's California worker just doesn't have the luxury to spend time learning what residents' rights are. They don't have the time to investigate where facilities cut corners. They need the ombudsman. They need to know that that advocate is there. California workers need to know peace of mind that their loved ones are going to be cared for when they have someone in a facility. So I ask that you support all of the safety net for our older Californians.
Thank you.
Carol Sewell from the California Commission on Aging. The Commission is strongly in support of the whole package of home and community-based program increases. We've had serious cuts over the last 5-10 years that have really damaged the system's ability to reach out to the people who need it the most. We especially want to express our support for the Ombudsman request. I can't add much to what people say, but I just ask that you keep in mind when we know that community care licensing can only get to a facility once every 5 years, it's really nice to know that the Ombudsman is there often getting to know people and paying attention. So thank you so much.
Thank you.
Rebecca Gonzalez, National Association of Social Workers, California chapter. We're also here in support of the long-term ombudsman's program. It really saves the state money, and it gives our seniors an additional voice to make sure their needs are taken care of. Thank you.
Thank you, Ms. Gonzalez.
Thank you, Chair, again, and committee members. My name is Rachel Robison, and I'm the Executive Director for Community Care Management Corporation. We serve Lake, Sonoma, and Mendocino counties, and we've been providing the multi-purpose senior services program for over 30 years, and we also run the Senior Information and Assistance Program and provide space at no cost to high cap. In Lake and Mendocino counties, we are finally, after 30 years of service, getting to a point where we can no longer afford to provide these services. We are at a deficit for the first time in our MSSP program and our senior INA program. And for a small nonprofit in a rural community, if we can't provide these services unassisted, nobody else can. And we have a disproportionate amount of seniors, frail seniors in Lake and Mendocino County who are also very economically challenged. And if we go away and can no longer continue to provide these support services, no one else is going to be able to step up and do it. So I please ask you to consider stabilizing these programs by restoring and increasing funding. Thank you for your time.
Thank you.
Hello, Graham Wright. I'm a volunteer board member for Ombudsman Services of Contra Costa. I'm here to support the additional funding. I was pleased to hear it acknowledged in this committee that it would be a great return on investment. I just want to focus on the efficiency of the program. Our two highly dedicated and underpaid staff members manage 40 unpaid and highly dedicated volunteers, and they support our community, and we estimate this funding may create one additional staff member for us. We can only assume that would provide 15 to 20 additional volunteers, and we could probably get those people up and running in 6 months or less. So it's very efficient, and please support the funding.
Thank you. Thanks for your volunteerism.
Krista Chelamides, Senior Advocacy Services Ombudsman in High Cap. I want to start off with how wonderful it is to hear you're a social worker. That's really great because obviously you get it.
Card-carrying member.
Oh, God, it works for me. I would like to point out, obviously everybody's addressed the good work we do, but a couple of the things that I haven't heard today is about our unfunded mandates. You know, you cannot get an advanced health care directive in a nursing home without us, and this is a mandate we're not funded for. It is extremely challenging for us to fulfill this mandate. And then the second one is elder abuse investigation. The California State Legislature, in their great wisdom, decided that the Ombudsman program needed to provide this service and didn't fund it. I don't know about you, but I think that is really a challenging thing to consider, and it's also disingenuous to our community members who think this is actually happening when we have mine, for example, my county, I have $137,000 to run a program to cover 190 facilities. Try to run an office like that. It's really challenging. So thank you for your
Thank you.
support.
Good afternoon. People far more eloquent than I have said it all. My name is Tippi Irwin. I'm from Ombudsman Services in San Mateo County. And I just want to say thank you for having this today. And I mean, just so much information, valuable information has gone in, but I want to support clearly the Ombudsman program and ask that you please put some of the funding in our direction. Thank you.
Thank you.
Hi, my name is Deb Russo. I am a volunteer member of the Contra Costa County Ombudsman Program. I also went through the Ombudsman Program as a volunteer several years ago. I live in Berkeley, been working in Contra Costa County. I'm here to support the Ombudsman program because I would just like to really say I'm here to represent John and Julie Citizen. If we don't already have members or family members or friends in a residential care or skilled nursing, we probably will in their future. And I also would like to mention that a lot of the people that we're referring to today, we're probably referring to them as the seniors, but there are vets in board and cares. There are people with other disabilities. There are young people. There are homelessness. And the truth of the matter is we keep referring to the thems and the theys and the seniors like there's some separate culture. It's us. We're looking at us. We want to fund us. And the sooner the better, so that when us get there, if in fact we do, there is going to be funding for really us as well as the empirical Russ. So I just wanted to mention that it's very important. And the monies that we lost back 2000 and 2008, we just want it back. We just want that money back. So thank you for your time.
Thank you. And thanks for your volunteerism.
Hi, I'm Deborah Hanshaw. I'm the volunteer coordinator for Ombudsman Services of Contra Costa County. And I just wanted to take a minute of your time to tell you a little bit about our volunteers. We have an extremely dedicated volunteer workforce, and they come from a variety of backgrounds. Including, we have some legal people, retired medical people. We also have retired nurse evaluators from the Department of Public Health Services and retired licensing or program analysts from Department of Social Services, community care licensing. And I think that the quality of our volunteers that we're able to attest, especially attracting them from those fields, attests to the quality of and the value of the Ombudsman program. So thank you for your time, and thank you for your consideration.
Thank you.
Hello, my name is Claire Smith. I'm a volunteer with the Older Women's League, OWL, here in Sacramento area, and we also represent a number of members at large across the state of California. It is really wonderful to have this topic discussed and see the time and consideration invested in this particular issue. We talk a lot about aging in terms of sort of a natural disaster, when in fact it's really kind of a luxury to have our communities living longer. And I want to say also we've heard a lot of about demographics, and the fact is that most of our aging Californians are women, and most of our older adult population are women, and also most of our caregivers, both professionally and informal in the home, are women. Thank you so much again for your attention. We embrace this opportunity, looking forward, and look forward to the discussion and working together with you. And we do support restoration and increase in funding to the safety net programs. Thank you.
Thanks, and thanks for your volunteerism.
Hi, Denise Leiker, MSSP Site Association, as well as Independence at Home in Los Angeles County. We're here to support all aging funding. It's a safety net that's fraying and very fragile in so many parts of the state, and we can't forget the largest population that we're serving. Especially for MSSP, we're seeking program stabilization, the cost of doing business, as well as the cost to purchase those vital services I talked about earlier today that make all the difference between institutionalization and staying in your home continue to rise. We appreciate the support in these times so that we can continue to serve. Thank you.
Thank you.
Nicole Wertelman on behalf of the Ventura County Board of Supervisors as well as the San Bernardino County Board of Supervisors in support of the $4.4 million restoration to the long-term ombudsman program, which provides quality services to some of our most vulnerable residents.
Thank you.
Hi there, Glenna Akers. I'm the MSSP site director up in 3 Northern California counties. Been around for about 30 years serving the medically frail older adults over the age of 65. What I want to emphasize this afternoon to you is that we are all partners. All of these programs that you've heard about this afternoon, we all work with each other to support each other to make sure that there is a network for older adults over the age of 65. So what I would ask of you, from the ground, we ask that you restore funding. Thank you.
Thank you.
Hi, I'm Teresa Ogan. I represent the MSSP program here in Sacramento, Yolo, and Placer counties. I can't say anything that anybody else hasn't already said, but what I can do is tell you about a client that we had for over 15 years, and She lived to be 104. She died about 9 months ago. When I did the quick math on that, over the course of 15 years, at the amount of money that we spent on that one client, at the end of her life, we saved the state approximately $600,000. If you apply that across approximately 10,000 clients that we currently serve in MSSP, and think about what we can do with the reinstatement of the funds that we lost several years ago, and also with the other programs here that are also asking for the reinstatement of funds. I think it's well worth the funding to do that. Thank you.
Thank you.
Dave Wiltsey, AARP California. AARP strongly supports ACR 38, which is Assemblymember Mitchell Brown's Family Caregiver Task Force bill and the funding of that proposal. AARP also strongly supports the $4.264 million appropriation for the Ombudsman program. And it needs to be noted that the Ombudsman will probably be in the forefront of implementing the RCFE, the Residential Care Facility for the Elderly, reform package last year, notably the implementation of AB 2171, the Bill of Rights for Residents, and AB 1572, the Resident and Family Councils. So thank you very much.
Thank you.
My name is David Moore. I'm also with the Ombudsman of Contra Costa County, and I'm a volunteer on the board of directors. You know that volunteers are wanted everywhere, and I found that there was nowhere that I could do a better job or a more important job than here with the Ombudsman. I just think it's a terrific organization. It very badly needs your help, and I know that you're leaning that way. Please do it. Thank you.
Thank you. I want to thank all of our presenters today and all of the staff and certainly our public and all of our partners. I think you all said it. It goes without say that these are important investments that we have to make, that there is no they, there is only us and we, and that when we support older Americans, we're supporting ourselves. And so for that, I want to thank you for your advocacy, for your attention to these important issues, for your passion, and we look forward to seeing you before this committee again. And now we stand adjourned. Thanks.